In this morning's Health Watch, we remember this day 5 years ago when the World Health Organization officially said that the COVID-19 outbreak was an international pandemic. We all remember that, as you likely remember this too. The coronavirus shut down life as we knew it, emptying the city streets and the office buildings, tanking the economy, bringing on social distancing and masking, and renewing appreciation for the healthcare workers. Remember when we were banging the pots and pans? In the U.S., COVID has killed more than 1.1 million Americans. By the time the WHO said it was no longer a global health emergency, that was in May of 2023. Still, tens of thousands more have died here since. Joining us now for a look back on the progress since then is Dr. Ashish Jha. He served as the White House COVID-19 response coordinator under President Biden. It's good to see you. You were a daily fixture on TV. I still can't believe, Dr. Jha, that it's been 5 years since we were talking about this story. I didn't leave my house for over 100 days because we were all so freaked out. Do you still think that COVID is still an issue today? And if so, on what level?
Well, first of all, it's great to be back with you guys. Thank you for having me back.
It's good to see you.
COVID is still around. COVID is still a bit of a problem. I think for elderly people, high-risk people, immunocompromised people, it can still be pretty serious. I think for normal, healthy Americans, no, I don't think it poses a big risk. We deal with respiratory viruses all the time. COVID is just one of them that we're going to have to manage.
How do you process now, looking back on what we went through?
Well, I feel like it was a crazy period of our lives.
Yes. But we got through it, though.
We did, but unfortunately lost a lot of people along the way. I look back at that time and I ask, what could we have done better? And how do we not make the same mistakes we made the last time around? Unfortunately, Gayle, we're going to confront a crisis like this again at some point. I don't know when. I want to make sure we're much better prepared, and I want to make sure we do it in a way that saves lives and doesn't disrupt our lives the way COVID did.
So how do you do that? Because one of the ways COVID is still with us, and I heard this on the campaign trail when I was covering it, a lot of voters are still angry. Yeah. They're angry because their businesses were shut down. Yep. They're angry because their kids weren't in school for years and still have learning loss. Yep. How can you maximize saving lives, but also minimize all of these side negative effects?
Yeah. So I think back to why did the shutdowns happen? Why was there so much disruption? We were not prepared. We didn't have testing around. We didn't have good surveillance. All of that, I think, really is what caused those problems. So if we can fix those underlying issues, I actually think whenever the next crisis hits, we can manage our way through it, not shut down schools. I mean, shutting down schools was a disaster. So we should never do that unless we're at an extreme point. But even all the other disruptions, I think we can avoid them if we have a good system in place, a good public health system in place for testing and disease surveillance.
If we're keeping schools open, why not go the full so-called Barrington Declaration, right? Where you protect the vulnerable, the elderly, people with underlying conditions. Yep. You let everyone else go about their lives.
Yeah, look, it sounds good on paper, and I understand why people find that idea attractive. The problem is the elderly don't live on some island by themselves, right? We have to interact with them. They get their food, they go to the grocery store, they go to their doctor's office. So the question is, how do you protect 30% of the population and let the virus run rampant in the other 70%? There isn't a feasible way to do it. No state was able to pull that off. So sounds good on paper, hard to implement. My view is you got to work really, really hard on making sure testing is available, but also treatments and vaccines. That's actually how you get through a pandemic. That's how we got through this pandemic. Focus on that. That's the durable solution.
So, Dr. Jha, it's not a question of if we will face another pandemic, but when. But you, in your comments here, have suggested that we might not be prepared. You say if we've learned something from COVID, if we have the tools in place to properly combat this pandemic. So we don't.
No, look, we are in better shape than we were 5 years ago. And a large part of the job I focused on when I was at the White House was making sure we are better prepared. And I would argue we are absolutely better prepared today than we were 5 years ago. But, I always think about the military's kind of mindset on preparation. It's not a one and done. They're constantly preparing. That's the way we should be treating this. We should always be focused on making sure we have the capacity to build up tests and treatments and vaccines and all the things that help us get through it. If we do that, we're going to be fine. What I worry about with this new administration is a lot of signaling saying, we don't want to be doing any of that. That's all in the past. You got to stay focused on this.
Yeah. We'll talk more with Dr. Jha in the 9 o'clock show, so we're looking forward to that.
Looking forward to that. Dr. Jha, always great to have you. Thank you very much.
Thank you.
All right.